Today I'm sitting with Dr. Ashok Kapoor. Hi sir, how are you?
Good evening, Siddharth. I'm fine. How about you?
I'm very good, sir. Sir, I'm very excited about the new initiative we have taken for starting ABCME. And today in this interview, I want to talk to you about this project and let our viewers know more about what we are planning to do. So I would take this opportunity to start with, sir. Why don't you tell us about yourself and all about medicine and what you have studied and everything?
Thank you, Siddharth. To introduce myself, I am Dr. Ashok Kapoor, and I'm basically a cardiologist attached to medical clinic, owning this Gatwell Medical Center, Curewell Diagnostic. But actual introduction will be that I am, by passion, by heart, a teacher, always interested in teaching the medical students from the very beginning of my career. It was about 30 years plus after doing graduation. We used to teach our postgraduate students for going for MD and MS and other exams. So that has been going on, and in fact that passion is still with me, and we try to do it in most of the ways. So in this career of about 30 years plus, with my internal medicine and cardiology, I got the opportunity to travel and work in Singapore, in Germany, in UK, in US, many places. And of course, back home in India, we worked in Shri Chitra Institute, CMC Vellore. And basically, I'm from Kanpur. Did my graduation, post-graduation from there.
Perfect. So, sir, my main thing is I am more of a business background. And of course, everyone respects the doctors immensely. But the first thing which I always wonder is the doctors study a lot for being what they are. So generally, a curious question that how many years did you spend in educating yourself?
Yeah, it's always to be answered with a laugh because we really feel, in fact, we give sweat and blood of about 12 to 13 years to become a cardiologist. So out of which 4.5 years is a graduation program. Attached to it is 1 year of internship. Then housemanship you do for 3 years. You continue with your MD medicine. Then DM cardiology. And of course, it never ends here. After that, I had to go for many fellowships in Germany, Singapore, and US and UK to complete my training as a whole, because at no single place you get everything what you want to deliver to your esteemed patients.
Right. And sir, I've seen your son growing up in front of me, and I feel very proud because now he's a doctor and he's practicing in UK. And I have some of my colleagues, who took medicine, they're still studying. But I see your son, Touchwood, finished his medicine fast. He's also already practicing in UK. So I feel it's also the guidance sometime which matters. So how you guided Ashu in doing the same?
Yeah, that's very right. You pointed out very well that guidance is very important in medicine, especially when you are odd man out, first doctor in the family. There's nobody to guide because it's a very complex situation. The trainings are available in India. You know about UK, US, European, Germany, and also people have no idea many times absolutely till MBBS what is their next step, and they straight away start thinking of getting some post-graduation here and there, or they enter into simple practice. So that guidance really helped my son, that he was one of the youngest amongst his group to do his MRCP within 1.5 years of his internship. Whether about 2 years, you can say, he completed his internship. In the meantime, he started his MRCP 1, he did 2, and PACES. And that was all because of the guidance. It's a very simple system. People are afraid, going to UK, it will be a complex situation, it's a conflict. No, it's not at all. I'm saying the best thing is that you don't have to waste time for doing post-graduation in India to enter for your post-graduation training in UK. So start it at the earliest, and you save time. And the training is one of the best guaranteed in UK. That way, if you reach in time there, then you have the enthusiasm to learn, and after internship especially. But if you have already done MD, there is also still possibility, and a lot of students are still going who missed the bus. So now we guide them in sending them to UK. So this is how I guided my son, together with a lot of my friends' children who are also with him in UK, fortunately pursuing their specialty training in cardiology, endocrinology, anesthesia, and many subjects. So there's a group of people whom we guided. They're already practicing.
Yeah. In fact, I see, Doctor, you are doing a lot of charity work, and actually you keep guiding a lot of people. And I see your passion for education also. So I think it's a passion which is driving you to do this. But I want to elaborate what you said more clearly. So who should do MRCP and what is MRCP?
Yeah, MRCP is a postgraduate training program of General Medical Council UK, United Kingdom. So this is what you can say almost equivalent to MD of India. But the advantage of doing MRCP, it opens your gates to do your practice in Middle East, to practice in UK, and of course in India you are also taken equivalent to a postgraduate doctor. So before entering into specialization, you need to do internal medicine, which is all about MRCP. The full form stands as Membership for Royal College of Physicians. So it's basically internal medicine training of about 2 years, during which you complete your MRCP. Or if you do your MRCP before even entering to UK, because it opens your gate to enter to UK, where you can go for specialized training, like in endocrinology, in cardiology, in nephrology, or whatever your subject of choice is.
Right. So yeah, I think my next question was that how does it help? I think you already answered me that it opens the gates.
Yeah, well, it opens the gates, and the number two advantage simultaneously is that it financially it's placed above all the qualifications. You know, if you have done MD from India and MRCP from UK, the MRCPians get much higher pay packets financially. They are compensated much better here as well as in UK. So that advantage is always there. Plus, of course, you have a freedom to practice in UK and get further trainings, guided trainings, fellowships in UK.
Right. So we are talking now about mostly the doctors who have studied MBBS, or even the specialists who have done MD or some specialization in Asia, Middle East, Pakistan, India. So the specialist also.
I had mentioned initially that some people missed the bus. They had no guidance.
Right.
No guidance. So they went for post-graduation in India, and then they are looking for specialization in their subject of choice, like endocrinology, diabetes, thyroid, cardiology, diabetes. So those students now find another gateway to enter UK for specialization of their choice by completing MRCP sitting back home in India or Pakistan or Middle East. They need not go to UK first. They just complete MRCP and the gate opens, and then they can enter into the subject of your choice. In fact, this year itself, many of our known have done MD from India. Then they completed with 6 months to 1.5 years the MRCP, and now they are already having good placements in UK. This advantage will go to the MDs who have done a post-graduation but looking for specialization.
Right. And is it accepted in Middle East, India, or Asia, Pakistan, all these countries? Is it accepted, MRCP?
Yeah. Now it's recognized in Middle East very well. And as I said, they are taken straight away as senior or specialist position they are given with a good financial packages. Back home in also in 2018-19, the MRCP in all private and government hospitals has been recognized. Same is in Pakistan and Far East even. So our audience of students are globally. They come from Far East even as far as Singapore, Indonesia, Hong Kong, of course India, Pakistan, the subcontinent, and Middle East.
And doctor, how does one apply for it?
Yeah, that is what is
how
our
does one apply for an MRCP?
A to Z. This is what I'm sure the program is all about. We not only just do the teaching, we'll guide them how to apply, how to get registered enrolled into that system, appear in which city. So full guidance package we will give them, so that sitting at home in Delhi, Mumbai, or even Bangalore or Kerala, they can appear in the exam in their city of choice, MRCP 1, with the application form, everything being done online. So this is what our faculty will guide them. We have a huge faculty which exists, which is based in India, Pakistan, Middle East, as well as in UK. So all the guidance material and people are available to guide our young doctors to go in for MRCP. That's not a problem.
Doctor, what courses are we doing in ABCM?
ABCME is basically has been started to deliver all types of UK-based Royal College courses. To start with, we have been doing courses for MRCOG, MRCP, PLAB a long time. Then for 2-3 years there was a break, and then COVID came, and now suddenly the rush has come, and we have launched this new academy in which we plan to start with medicine. Then we will join with the other specialties like OB-GYN, surgery like MRCS, so even the PLAB in the coming time. So MRCP itself is a very big arena which covers MRCP 1, then we'll start with MRCP 2, all online, and even PACES. We have the talent available, we have the manpower available, we have the material available to deliver even online, lot of material for PACES, and ultimately we can give them crash course face-to-face of PACES also, so as to complete the MRCP for students going through us within 1.5 to 2 years, and even earlier. Some students do it very fast.
So, Doctor, I want to also ask that sometimes the mentors should be very important. So, the faculty we have in these courses, they have a good background with such exams?
Yes, you see, I have been into teaching profession for a long time.
Right.
Our academy was working for a long time, and back home in India also I was in a teaching profession, involved in this. So passion is very important. So I basically have made sure that the faculty which we will have will deliver the best, because we monitor them, we mentor them even, so as to have the best results of our academy. So this will make sure, this is guaranteed. We can vouch all the success to our students once they are in our academy. That will make sure.
Right. So, how will these courses help the people who are already appearing for such exams?
I mean, so already if they are registered, then no problem. I mean, so this exam is like, a long-term study. It goes on. But you need guidance, what to study, what is more important than what is not very important. So everything about medicine they need to know, but we will give them guidance on almost all the subjects. There are about 13-14 subjects we select, like cardiology, nephrology, clinical sciences, hepatology, the various topics. So we select them and give them to the best of the faculty who can deliver. Like gastroenterology will be delivered by a gastroenterologist. Cardiology, like me, will talk about cardiology. Nephrologists will deliver the nephrology lecture. So you can understand a super specialist delivering the best for the basic students who are trying to enter into this field. So we will give them the best of the material, best of the guidance. So this is how we have selected our faculty as a whole.
And in these COVID times, Doctor, I want to know people from different parts of the world, how can they do this course?
Yes, this is the advantage of our ABCM.
So, is it online completely?
Yes, that will be totally online, no touch, and we'll make sure it is better than face-to-face and touch technique which we have been using. We have done face-to-face course, plenty we have done in Delhi, we have done in Dubai. We've been doing it since 2011, but this will be because of the COVID, things have changed, the world is different, and online technology has come really handy, and we are rehearsing it for a long time, and now we have came to conclusion that we'll go online, and I'm sure the students will realize that it is even better than coming all the way to Dubai or Delhi for the course and then staying there, then and different thing. In your drawing room, in your bedroom, in your study room, you will be given the best of the material.
Amazing. I think, Doctor, I got good information to pass on to various doctors. In our next video, I think we can also try to discuss about what is MRCP1, MRCP2, and what is PACES, and also about other specializations. But I thank you for this meeting, Doctor, and I'll hope I can circulate this to as many doctors. And if they are interested, they can log on to ABCME and register with us. We'll be more than happy to answer all their questions.
Thank you so much.
Thank you, Dr. Ashok. Thank you.